Hi Warm Springs, this is Taylor Gilbert, physical therapist at Warm Springs Holistic Health Clinic, and today we're going to focus very much on just running. So we're going to talk a little bit about different stride varieties with running. There are three main strides out there that people talk about when you're talking about your running. So there's a rear foot strike or a heel strike pattern, there's a midfoot strike, and then a forefoot strike. So the rear foot, or the heel strike, is your typical running that you would see. You're landing on the heel of your foot, and then you're rocking forward as you run. So that pattern, you're doing most of the shock absorption of the run through your knee. So you're really working your quads pretty hard. The midfoot pattern, you're more landing on a flat foot, so you're using your ankle a little bit, but you're also using your knees and hips as well. So you're kind of taking the best of both worlds between the rear foot and the forefoot strike. The forefoot, you're up on the ball of your foot, and then your calf, the big muscle on the back of your lower leg, is lowering you down to the ground. So all of the shock absorption is happening at the ankle and is being done through the calf. Obviously there's a little bit at the knee as well, but most of it is at the ankle. So there's pros and cons to all of these. If you're somebody that has a predisposition to an injury at your calf, you might want to pick a different one. If you have a predisposition to an injury at your knee, maybe a heel strike pattern is not for you. A lot of runners, they've done research, and a lot of elite runners will use all three of the different varieties just in one race. So probably the best thing that you can do for yourself is have variety. Not do the same thing over and over again, but be able to move fluidly between all the different patterns. And definitely something you want to avoid is called overstriding. That's where your foot and leg is getting out in front of you. When you land, you want your foot underneath you. That keeps your center of mass and your gravity all in one place, and your balance is just a little bit better. When you get too far in front, it's difficult to control that, so you're more predisposed to an injury. If you're somebody that knows this and is still having some problems or any injuries, talk to your primary care physician, and we can get you at the PT clinic and take a closer look at your running form and see what we can do for you. Hope that helps.